We are at Walden today with a very important conversation. We're going to talk about resources in St. Mary's County that almost anybody can utilize at some point, whether it's for themselves, a family, a friend, what have you. We'll get to that. Let's first of all introduce Laura Webb. Laura, it's always nice to see you on MetroCast Channel 10.
Great to see you.
Good to have you. And Joanne Guy, you're newer on MetroCast Channel 10, but we're excited to have you. You are part of the new and expanded services at Walden. Everybody has known for years and years that Walden is a place they can really depend on if they need behavioral health, mental health services, what have you. But there is an expansion. We're excited about what you're doing. Why don't you tell our viewing audience what it is you do?
Okay, thank you. Yes, right now we have the outpatient mental health clinic here at Walden Behavioral Health, and we help anybody that has any type of different issue as far as anxiety, depression, even more severe mental health symptoms. At least anybody can come and see us. We have 12 different therapists in 4 different locations. We have actually, and also 3 different counties. We have a therapist in Prince Frederick, Waldorf, and then right here in Lexington Park, and also Charlotte Hall.
That's incredible. And I have been educating myself and our audience over the past several months about what Walden does in the community. It's amazing how many people you serve and take care of and so forth. Laura, let me direct a question to you. What kinds of reasons do people come to Walden for health and for health help, and how do they get to be a part of it?
Well, it really can be for any reason that's disturbing the person and impacting their life, Elisa. It could be something that they find is situational in nature, a crisis, a situation that's happening, or those kind of symptoms of depression and anxiety that really don't have an explanation. Okay. And sometimes we also need to be aware that those type of symptoms can be physical ones. Difficulty with pain that can't be explained, fatigue, upset stomach that can't be explained could actually have a mental health component to it, and everyone deserves to be healthy,
absolutely,
to live the life that they imagine, and to enjoy their lives. So we really want to have an encouragement out there to help people take care of here and here, as well as the body.
I like very much how there has become a bigger dialogue in our culture about mental health issues. Sometimes they're acute and they're for a short period of time, sometimes they're lifelong, but there is more open dialogue and less of a stigma of people opening up and saying that they need help. Joanne, let me ask you, in your position as the clinical coordinator, what kinds of things do you encourage people, this is when it's time to get help, or at least ask somebody for an evaluation?
That's a really good question. I try and encourage people if they're struggling in any way, shape, or form in their life, whether they're just going through an adjustment as a new job, maybe struggling in their relationships with their children or in their family, divorce, a separation. Our therapists are wonderful at helping people through all these different types of traumas in their life. It can be something major, like losing your house, or losing your kids, or something minor as in you're feeling really stressed out and just need some help to cope with that.
Okay. And Laura, you've had a lot of experience in St. Mary's County. You've been with Walden for a really long time, and you know how good of a program this is and how robust it is. So you're really able to work with people and just say, here's a path for you to take, here's a direction you should go, and really just encourage people to reach out and ask for help.
And it's so important to remember that 1 in 4 people, 1 in 4 people in our country actually experience mental health issues where they could use some assistance. It's absolutely something that you want to check into if you're not feeling well. In addition to the therapy that Joanne talked about, we also have psychiatry available. And pairing those 2 things together, along with other aspects of taking care of yourself, can really make such a powerful difference in quality of life. So worth doing.
Absolutely. Now, we've been talking so much about the person that needs help. What about support services or suggestions for people that are around that person and love them? What do you encourage them to know about?
So yeah, I mean, that's so important as well. We do have some services where we do some education around mental health. We offer Mental Health First Aid USA courses with the community here via Walden, and we also encourage connections with groups like NAMI and other supportive groups in the community. Our website has some information that can link folks with those other resources, and if anyone's interested in those courses like Mental Health First Aid USA, all they have to do is call us.
Absolutely. And I love getting to talk to you. We've known each other for a few months now, and the more we talk, the more I realize this county so takes care of itself, and your services are so robust and so deep and so varied and so wide. The best thing to do is go online if you need help or you know someone that needs help, or give somebody a call and get things started. And congratulations to you, Joanne, on your new position. You've been with Walden for a little bit, but they're expanding their services and your new position as the outpatient mental health clinical supervisor. That's a mouthful.
Yeah, it is. It is. It is. Yes, thank you very much. I'm very excited to be able to bring this to Walden. And I do agree with Laura that you need to take care of your whole body. It's not a matter of having one problem and just staying home and not being able to deal with it. At least we also offer family therapy.
Okay.
If we have a family that's struggling with a child who may be struggling in school's getting ready to start, so having trouble getting back into the groove of things, difficulty with grades, and mom and dad need some support, we have help with that as well.
Like I said, your services are varied, wide, and robust. Laura, it's always nice to see you. Joanne, welcome aboard and congratulations.
Thank you.
What a great thing to be able to do for our community.
Thank you.
Thank you.